Hello, everyone. Let's check who is live, who is online today to join our live section. So we're just going to wait and see who is going to join. If you are joining us, kindly let us know where you are watching us from. Kindly drop a comment on the comment section and let us know where you are watching us from. And if you've not watched our recent video where we explain the type of abortion, I will advise you to check our recent videos and also watch to stay informed. And if you've watched any of our recent videos and you have a question, kindly drop on the comment section. Hello, Chidera. How are you doing? Good evening. It's nice having you on our live, Chidera. Where are you watching us from, Chidera? And do you have any question for us today, Chidera? So we have John C. Tomatoes. John C. Tomatoes, how are you doing? Oh, I think hair is entering my eyes. Sorry. Something is entering my eyes. Okay. Hello, John C. Tomatoes. How are you doing? Good evening. And let us know where you are watching us from. If you have any question, kindly drop on the comment section. So we have Kote Niani Massa watching from Gambia. It's nice having you today on our YouTube live. Hope you are doing great. And do you have any question for us? Have you watched our recent video where we talked about abortion? Let us know your opinion about abortion. And if you're having issues, you have any question, drop on the comment section. This is a YouTube channel where we talk about your sexual health, your reproductive health. We talk about health in general. And Chidira said, sorry about that. You're welcome. We have Joy. Joy, good evening. Good evening, Joy. How are you doing? It's nice having you on our live section. Do you have any question for us today? So for those that are just joining us, this is the first time of you coming across the space. My name is Mercy Mary. I am a registered nurse midwife in Nigeria, but I'm currently practicing in the UK as a registered adult nurse. And what I do on this channel is to talk about health, is to take your questions, provide answers. But generally, our live sessions is usually for taking questions. That's what our live sections are. We upload videos regularly as much as we can, but our live sections are for taking all your questions. So if you have any question, kindly drop on the comment section and I'll be so super excited to know where you are watching us from. So we have Exodus. Exodus, how are you doing? Exodus said, how are you, my nurse? It's nice to see you again, Exodus from Cape Town. Hello, Exodus, longest time. It's nice having you on our live section today. Do you have any question? Oyenekikilomo. Oye, let me call you Oye. What can I use to cure toilet infection? First of all, what are the signs that you having? When you say toilet infection, what do you mean? Are you talking about urinary tract infection in a situation where you are having a burning sensation, like whenever you want to pee, there's this burning that comes with your urine, there's inching of your private parts? If that is what you're talking about, I will advise to see the doctor. They might give you some bacterial medication, antibacterial medications, that's your antibiotics, to actually help with the bacterial infection. So if it's a UTI, the doctors are likely going to prescribe an antibiotics for you and some other medications together to help with it. And generally, what I advise you to do when it comes to that UTI, it's not known as toilet infection per se. It could be urinary tract infection. I will advise you as a lady to always check on putting on clean panties. Try as much as possible to change your panties regularly. It's very important. And also you have to be careful of the toilets you use. It's also very important. Then sometimes it's not just about the toilet, it's about the product you are using. I can't overemphasize the products you're using on the vagina. Some of us, we use hash soap to wash our vagina. We wash the vagina as if we are washing clothes. We wash the vagina as if we are washing a dirty plate. No, the vaginal itself, I can't overemphasize this fact, is that it is self-cleansing. It cleanses itself by itself. So you don't need to consistently wash the vagina over and over again. You just need warm water to actually clean that area. And even if you are to use soap, you can use a mild soap to foam it with your finger and apply it around vulva gently, even if you want to use it. But generally, I advise using warm water only to wash the vulva. I mean, the vagina is self-cleansing. You don't need to put anything there. So avoid harsh soap around that area. Wear cotton pants and see how it goes too. I don't know if that helps. Or yeah, just let me know if that explains it better. Then see a doctor to get some antibiotics prescribed to get that infection out. So if you are watching, you are still here, just double tap on the screen and it automatically likes the video. You double tap on the screen and it automatically likes the video. So we have Chidera. Chidera said, Ma, please, I don't know why I keep having eczema on my back. And if I treat it, it comes back in a month's time. Hell, in terms of eczema, I can't personally give you advice when it comes to eczema because I don't really know much about skin. I don't know much about skin. I don't know much about skin infection and how to deal with it. But what I generally advise, you can get some is it antifungal? No, I've forgotten. You can see I can't really remember anything about skin. So my area of specialty, the knowledge I have is not necessarily to skin. If you can see a dermatologist can help out to tell you the actual cream you can use for your eczema. I think so. But what I can do is to try and see if I can study more about eczema and see if I can make a video for you, if that makes sense, Chidera. I'll try and see if I can study more and see if there are any options, like treatment options that I can talk about that can help you for the eczema. I'll check about it. If I don't make a full video on it, I'm going to do a short video on it talking about the treatment for eczema. Does that make sense, Chidera? But if you can, I would advise you to see a dermatologist, an experienced dermatologist. They should have a better idea because I have someone, I think I'll have to ask the person. I have someone who had severe eczema over time, but with the help of a dermatologist and a doctor, they were able to get rid of it permanently and it didn't come back again. So I'll kind of ask that person based on experience and also check online. Then when I get any useful information in regards to that eczema, I might pop the video if that helps, Chidera. All right, thank you, Chidera, for dropping on our live. All right, you're welcome. So if you have any question, kindly drop on the comment section. And if you've been watching so far, all you just need to do is to double tap the screen and it automatically likes the video. Okay? When you double tap the screen, it automatically likes the video. Let's see who has any question for us. Kindly drop on the comment section. I might move this way. I just want to move my chair a bit. Okay, I think that's better so I can see my screen. Let's keep the questions coming. Johnson, good evening. Do you have any question for us, Johnson? I am waiting for your question, Johnson. Where are you watching us from, Johnson? I have a friend called Johnson back then in the uni days. Yeah, we started in Pedigree. He was my good friend. So do you have any question for us, Johnson? Hey, Johnson said he's watching from Enugu State. Thank you, Johnson, from watching all the way from Enugu State. How is Enugu? What's the weather over there? Good, great. Let us know in the comment section. All right, that's good. I heard it's dry season. They call it Hamatan. Hamatan over there. So, who has question for us? Kindly let us know. We are ready for your questions. What? That was 25th November. November. Hello, everyone. If you're just joining, kindly let us know where you're joining us from. Hello, everyone. Do we have questions for Nurse Mercy Mary? How are we all doing? How are we preparing for Christmas? Since there is no question on our health, let us know how you're preparing for your Christmas. What are your plans? Are you traveling? Are your clothes ready? What exactly are you planning for Christmas? Personally, on Christmas Day, I am not working. I am at home this Christmas. I'm not working this Christmas. I am basically at home this Christmas, so I'm not working. So you're gonna see more of my face. Yeah, it's not just. Hello. Godwin, how are you doing? Trust you're doing great. It's nice having you on our live section. Let us know where you are watching us from and if you have any question. Godwin, nice having you here. Rachel, how are you doing? Thanks for joining the live. Where are you watching us from? And do you have any question for us, Rachel? How is it going over there? And how is your Christmas preparation going, Rachel? I'm fine, Rachel. I am fine. I'm here to take your questions today. So I'm just going to be live for some time. Hey, hello, Privilege. How are you doing? Watching from South Africa. How are you doing, Privilege? How is South Africa? Trust everybody is fine in South Africa. Rachel is watching from Burkina Faso. How's Burkina Faso? How's the weather? What's the Christmas preparation like in Burkina Faso? I believe the Christmas lights are on. The Christmas tree is all decorated. How is it going? I'm good. No, South Africa is good. That is great. All right. Privilege said it's been raining lately. Oh, it's raining. Burkina Faso. What season? How many seasons do they have in Burkina Faso? I think I should learn. How many seasons do they have in Burkina Faso? How many seasons do they have? Like in Nigeria, we have the raining season and the dry season in Nigeria. Then in the UK, we have the summer, autumn, spring, and winter. So how many seasons do they have in Burkina Faso and what do they call it in Burkina Faso? Privilege said maybe she's asleep. Who is asleep? Privilege, who is asleep? Who is asleep, Privilege? It's raining and dry season. That's same seasons we have in Nigeria, raining and dry seasons. Who is asleep, Privilege? Okay, no, she's answered. She's answered. Rachel has answered. She said there are two seasons. We have the rainy season and the dry season in Burkina Faso. So she's back. Yeah, she's back now. What about you, Privilege? What seasons do you have in South Africa? What seasons do you have in South Africa, Privilege? Joseph, how are you doing? Good evening. How are you doing, Joseph? Trust you're doing great. It's nice having you. Oh, three seasons. What are the names of your seasons in South Africa, Privilege? Now I know that Burkina Faso has the same seasons with Nigeria. Let me know about South Africa so that I can also learn how many seasons South Africa has. How many seasons are in South Africa? I really want to be summer, winter, and autumn. Okay. There's no spring in South Africa. Like in the UK, we have summer, winter, autumn, and spring. So in South Africa, we have summer, winter, and autumn. So no spring. Okay, that's fine. Now I know. Probably I would like to visit South Africa one of these days. So if you're just joining, kindly let us know where you're watching from. Don't forget to double tap the screen as it automatically likes the video. If you have any question, just drop on the comment section, okay? Privilege, I'm not a GP, I'm a registered nurse, but I work in a theater. So I am a theater nurse, but my specialty in the theater is anesthetics. So we are the one that helps with this. We help the anesthetics with sedation while the patient go to bed. So I do more of anesthetics and recovery. So I don't work in the GP. I don't work as a GP. So I do anesthetic and recovery nursing. So I've been on annual leave for some days now, but I'll be resuming back tomorrow. I'm on night shift tomorrow. So I am not a GP. I'm a registered nurse working in the theater. What do you do, Privilege? Are you a GP? Are you a registered nurse? I would like to know. Rachel said, please, I don't know if we can chat on WhatsApp. I want us to talk about my fertility issues. Okay, can we have a discussion here? Because if I say we should talk on WhatsApp, sometimes I might not be readily available. Okay, that's one thing. You can send a message on Instagram and I'll see how I can get you, how I can get across to talk to you about this. But if you have a beat, you can share some beats, then we can discuss about it on the live section. If that's okay, that's much better because my Instagram or my WhatsApp, it might take long for me to answer because I have a lot of messages and I don't really know where to start from. It's really difficult. So that's why most times I do the live section to take questions. So with the live sections, it's much easier to answer everybody than going one after the other on the WhatsApp page trying to answer. It's a whole lot, trying to type, trying to do some voice recordings to answer all the WhatsApp messages. So that's why, Rachel, if you like, it's better for you to just ask it on the live. We can discuss. I'm going to take the question one after the other for you to see what we can do about it. So that's what I can say, Rachel. So Privilege said, nope, I am a farm worker at a private game reserve. Okay, all right, that's good. Like farmers, I think farmers make a lot of money. Farmers are like, depending on the farm, I think farmers that produce the food we eat, that's a lot because we can't survive without food. So food is very important. So we need the farmers. We need a lot of farmers. We need a lot of food. Because without this food, definitely we are not going to survive. We need the fresh, natural food more than the processed food. So what does the game at a private game reserve? When you say private game reserve, what in particular? If you like to share, it's fine. If you don't want to share, that's okay. Okay, it's called African Parks. Okay. I think that is going to be like a place for tourist center. It's more or less like you can do some tourist around that area. That's good. That's good. Maybe when I come to South Africa, I'm going to visit the Africa parks and ask for privilege. Is that okay? Just keep an eye. When I'm going to South Africa, I'll let you know. Like I can visit and see some other bits. Oh, that's good. Thank you very much, Privilege. I really appreciate it. If you've not subscribed to our channel, kindly do so. Don't forget to double tap the screen as it automatically likes the video. Thank you very much, Privilege. Thank you very much. Don't forget to engage on our videos. I want to see your beautiful comments on our videos, your likes on our videos, and also your share on our videos. Thank you very much, Privilege. I appreciate. Yeah, I always do the live stream. I'm trying to do the live stream, but I can't tell you the exact time when I'm going to do the live stream. So I just come live when I am less busy and when it's like it's convenient for me. Thank you, Privilege, for staying back on our channel. I joined late to be more engaging next time. How do we know you're live? Okay, to know I am live, all you need to do is to subscribe. Click on the subscribe button, and there is a notification bell over there So you turn on the notification bell. Just click on the notification bell and turn it on. So whenever I go live, you're going to get the notification on your phone directly. So, but I'm trying to do it usually between 1, 2, and 3. Between 1, 2, and 3 when I'm on night duty. And when I'm on day, it might be at night. But I'm trying to see if I can do more live. So hopefully you'll be getting more. Just subscribe. When you subscribe, turn on the notification bell by the side. It's going to turn, like, it's going to alert you on your phone automatically when I go live. So we're going to be doing more topics on our live section from tomorrow. Okay, so all you just need to do is subscribe and turn on the notification bell. Thank you, Widusu. You're welcome. Thank you very much. I really appreciate. Okay, Privilege is asking if we can brief her on what we spoke today. I think what we are talking today was about abortion. So I have a video on it. The last video on our YouTube channel, we talked about abortion. So I'm going to give you a summary of what I said about abortion. So I was trying to explain that there are basically 2 types of abortion on the video. You can watch the video to get a better information, and also like, subscribe, and also drop a comment in regards to your thoughts on it. So I talked about abortion, the different types of abortion. Like, we have the medical abortion and the surgical abortion. The medical abortion has to do with you taking pills to take it, like, to terminate a pregnancy, while the surgical abortion has to do with you going to the hospital. So the surgical abortion is pretty quick because it's just between 5 to 15 minutes and it's all done. But for the medical abortion, you have to take pills, and sometimes it can take from a couple of hours to days for it to be like success, for the whole thing to be out. So I talked about that, and then I talked about the myths associated with abortion. Like, people say that abortion generally affects your fertility. I explained that on the video, and people also say that abortion is not safe. I also talk about that on the video. You can just check. It was uploaded like, I think, an hour or two ago. So I talked about that, if it's a myth or if it's true. Some people say it's not safe. Some people say that abortion is only done by some certain type of people. So I explained that, and that helps you to check out if it's a myth and why it's a myth. And we talked about the facts about abortion. So I think that was what today's video was talking about on our YouTube channel. So you can check that out and see how it goes. Does that make sense, Few Village? Did you get that? All right, Privilege. You can watch the video. That's going to go along with her. All right, that's good, Privilege. Okay, and also if there's any topic you would like us to discuss in our next live section, that's tomorrow, kindly let us know. If there's any topic you would like us to discuss in our next live section, kindly let us know in the comment section. The live session is likely going to be between 2 to 4 p.m. in the afternoon. That's UK/Nigeria time. So if there's any particular topic you would like us to discuss, kindly let us know. Is your time same as South African? Here it is 23:28 p.m. Here it is 21:30. So it's like 20. It's like 2 hours difference from South Africa. I think our time zone is 2 hours different from South Africa. It's 2 hours different from South Africa. So just calculate, like, if I say I'm going to be here by 4 p.m., in South Africa time, it should be 6 p.m. So if I say I'm going to be here between 2 p.m. to 4 p.m., in South Africa time, it simply means between 4 p.m. to 6 p.m. So that's when I'll be coming live, because I'll be going to work later. By this time tomorrow, I should be at work because I'm on night duty. He said, okay, thank you. I did get it. You're welcome. So if there is something, like Elia said, you would like us to discuss tomorrow, kindly let us know in the comment section so we get ready. But if there is nothing, tomorrow I'm going to pick a particular topic we'll be talking about. Hopefully, we're going to be talking about, let's see what we have here. Hopefully, we're going to be talking about, let's just check, just wait a bit. Where is it? Where is it? All right, for those that are just coming across this channel, my name is Mercy Mary. I'm a registered nurse midwife. Feel free to subscribe, feel free to follow, feel free to drop a comment and let me know where you're watching from. And if you have any question, let me know. Tomorrow we might, please check my question. Privilege, I didn't see your question. I'm not getting your question, Privilege. Your question did not pop up. If your question contains some words that are prohibited on YouTube, it's not going to pop up. That's one thing about YouTube Live. If your question contains those words that are prohibited by YouTube, it's not going to surface. So if there's a way you can modify the question so it doesn't create prohibitions on YouTube, that would be better. So what's the best time to stop breastfeeding a baby? Okay, according to the World Health Organization, they said you can breastfeed a baby up to, I think, up to at least a year. Wait. So you can breastfeed a baby for up to 2 years. Generally, they advise you can breastfeed a baby for up to 2 years. But some people stop when the baby is 1 year. Some kids, when they are 6 months and they've tasted solid food, they stop. For example, particularly my kids, like 2 of my kids, what happened to them is that once they start tasting solid food, they stop breastfeeding. Like, I don't have to start forcing them to stop. They just stop automatically by themselves. So that's what happened to my kids. But some kids, they can breastfeed up to 2 years. But personally, my own personal experience with breastfeeding is that when my kids start tasting solid food, they stop breastfeeding automatically. They don't want to breastfeed again. So that is for my kids. But some people, they do express, keep it, and mix it with their food because breastfeeding is rich, it protects them, and it helps to boost their immune system. Some people breastfeed till 1 year. Some people breastfeed till 1 year and 6 months, even 2 years. But it all depends on you. But generally, they said you can breastfeed up to 2 years. All right. So if you still have enough, you can be expressing and giving the baby as milk. So does that make sense? Are you breastfeeding? Do you have a child you're breastfeeding? Because people can breastfeed for a long period of time, actually. Some kids, they don't want to stop breastfeeding even after 2 years. See, their friends start laughing at them like, oh, you're still breastfeeding before they start getting their mouth off the breast. But for my kids, it's totally different. For me, it's totally different because once they start eating solid, they are off by themselves. So I didn't really stop them. They just stop automatically by themselves. Probably because I sleep trained them on time. People say because I sleep trained them on time and they didn't really have to suck all through the night. So probably they don't need to have to breastfeed all through the night. Guess that's why they just gave up on breastfeeding like that. So probably that's why. So for kids that sleep together, that co-sleep with their parents for a long period of time, I think it might take a longer duration. For me, I started sleep training them on time. So I started sleep training them of time. So because of that, they stopped when they start eating their solid. So my wife sees my wife, yes, she's now 1 year and 10 months. Is it? Oh, she's the baby is still 1 year and 10 months, and she can do it in 2 years. Then 2 years, she'll start bringing it down gradually. But ensure that the baby is still having some good solid food. Solid foods are very, very important. So you have to ensure that the child is still taking those solid food. You're welcome, Privilege. It's nice having you. I'm super excited to have you. Oh, it's my husband. My husband played that, so I don't play that. So my husband just do it for fun and throw the dart spin and all that. It's not a game that I'm interested in, so I don't know how to play that. I'm not interested in that game, but my husband just play it for fun at home. So I don't know how to play that. Do you know how to play that? Oh, that's good. I don't know. I don't know how to play it. I don't know how it works. It's not something I'm just interested in. But it's my house. But I think I should start developing interest in it. Just that my husband just do it once in a blue moon. Like it just throw it sometimes, and this that can stay like for 2 weeks and it's not played. So it's more or less like if he was doing it regularly and consistently, probably I would have developed some interest in it. Well, he's not doing it. He's always busy. He's at work and most times, and so I've not developed interest. Maybe the day he starts like having this strong desire for it, maybe I'm gonna have this strong desire for it. But for the now, I don't do it. Yeah, that's what I heard because you kind of focus on that center point, that middle point over there, the middle. So if you can get it, I know about that middle point. So I'll try and see if I can build my focus with it. I'll try and see if I can build focus with it. So if you're watching and you've not double tapped to like the video, kindly double tap on the screen and it automatically likes the live session. It's not going to take long. Just double tap on your screen, 1, 2, and it likes the live section. And if you have any question, don't fail to drop on the comment section. I am ready to take your questions as usual. So that's why I'm here to take all your questions. And for those that are just joining, just seeing the face for the first time, my name is Mercy Mary. I am a registered nurse midwife, and I talk about reproductive health. So you can check out on our video and see how it goes. So Privilege said, I am out now. Sleep well, read Psalm 91. All right, thank you very much, Privilege. It's nice having you on our live section. It's almost time, and the live is likely going to be ending in 10 minutes time. So thank you very much, Privilege. I really appreciate your presence in our live section. See you on our next live section tomorrow. Hopefully, I'm gonna be looking out for Privilege tomorrow on our next live section. Thanks. Thumbs up. Thank you. See you tomorrow. It's the most wonderful time of the year. It's the most wonderful time of the year. So we have like 5 minutes time. The live is going to end. For all those that have joined the live section, I really do appreciate your presence. Thank you very much for joining. And if you've not followed our channel, kindly click on the subscribe button, like, drop a beautiful comment for us, and we are willing and ready to answer you. Okay? So the live is going to be ending in 3 minutes time. So if you have any question, this is an opportunity for you to ask before we go. So we have 3 more minutes to go. We have just 3 more minutes. If you have any question, can you let me know on the comment section? If you have any question, kindly let me know on the comment section. For the person that just came and gave me a thumbs up, thank you very much. Can you drop on the comment section and let me know where you are actually watching me from? But the live is going to be ending in 3 minutes. 3 minutes. So we have 2 minutes to go. Count down to 2 minutes. The live is going to be ending in 2 minutes. This is me saying thank you very much to all those that have joined the live, and I hope you enjoyed the live section today. Tomorrow we are going to be having another live section. Yeah, we'll be talking about something interesting. All you have to do is to click on the subscribe button, turn on the notification bell. So when we tend to upload a video or come live, you get notified and you come down directly. So that's the bait. So life is going to be ending in less than 1 minute. All right, before I go, the life is ending now. I will just do a final introduction for those that came late. My name is Mercy Mary. I am a registered nurse midwife. So if you missed this live section, don't forget to join us tomorrow. But tomorrow's live section is going to be between 2 p.m. to 4 p.m. The UK time. So all you just need to do to get updated of our next live section is to subscribe, turn on the notification bell, because when you turn on the notification bell, it is easier for you to get notified and join our live section. So that's all you need to do to join our live section. Kindly let me know on the comment section as usual. Don't forget to drop a comment. We've posted a video today. Don't forget to engage on our post. And this is Nurse Mercy Mary saying thank you very much. Thank you very much for joining, and probably see you in our live section. Bye everyone. Bye bye.